really afraid I'm gonna forget to record. But we are recording now. So I am just going to give a brief introduction on what the Engage with DLD project is for anyone who isn't aware of it. And I'm just gonna keep admitting people as we go. So, Engage with DLD or E-DLD is the first international database of individuals with DLD. So, we are targeting recruiting parents of children with DLD under 16 and individuals with DLD who are over 16. And the point of the project is to help facilitate and to build research capacity in the DLD space. Because we do know that there is less research on DLD than there is other neurodevelopmental disorders, given the prevalence of DLD and given the severity of DLD. So we advertise ethically approved DLD research projects on monthly basis. And we also sometimes ask for opinions and research ideas from our members as well. So we sometimes host E-DLD only events. So this is sort of the framework that we have for the database is that parents of children with DLD and individuals with DLD over 16 join E-DLD. They become E-DLD members. And then research with DLD projects, they come to us and submit an application for advertising the research projects, and then we send monthly or quarterly research emails depending on what the preference is for our E-DLD members. So either they get an email once a month telling them about research projects that are ongoing, or it's every 3 months. So this is the essential bit of E-DLD. I will put a link to where you can sign up to join E-DLD in the chat later on. But right now, I'm just going to introduce Dr. Taha, and she is from UCL. I'm going to stop sharing my screen. And you can start sharing your screens as well. And I have to admit, I forgot to do some background information on where you're coming from, Dr. Taha. So maybe you can give a brief introduction to yourself. And then let's begin the talk today.
Thank you, Michelle. Can you see my slides okay?
Yes, it's not full screen though.
Oh,
I
let
saw
me
you
just,
do it, but I don't know why it hasn't shown up.
sorry, let me just try again. Um,
There we go. That looks better.
Perfect. Okay. Oop. Okay. Thank you, and thank you for having me today. Today, I'm going to talk about some of the work that we have been doing into looking at research evidence on what approaches work for supporting and identifying children with speech, language, and communication needs, including those with developmental language disorder. Before I start, I'll just give you a bit of an introduction about myself. So I'm Dr. Juhayna Taha. I am a researcher and a lecturer in language and literacy at University College London. And I'm a speech and language therapist by training. And most of my research focuses on trying to understand typical and atypical reading, writing, and language development. I have a particular interest in studying and working with children with developmental language disorder and dyslexia. And recently, since joining the Institute of Education, I started looking at DLD and language difficulties in the context of classrooms and how can teachers and classroom environments impact the development of language in children. So, what I'm going to do today, I'm going to just start with a very brief overview about speech, language, and communication needs and developmental language disorder in the UK. I'm going to present to you and give you a little bit of a context about the research report that I'm going to be presenting today. And then I will be sharing some of the results from that we got from the report, which focus on the best available evidence on the different approaches that are available for identifying speech, language, and communication needs in educational settings, as well as different approaches for support. And I will also briefly talk about what we found in terms of the evidence available on school and families' partnerships and how their collaboration is important for supporting children with SLCN, including those who have developmental language disorder. So, before I start, I just wanted to give some key definitions. So, speech language and communication needs is a term that is often used in the UK to describe children who have difficulties in any aspect of communication. And it is really an umbrella term. So, it refers to children who might have language difficulties, so difficulties in using or understanding language. It might refer to, or it might be a term that we can use to refer to children who have speech sound disorders or difficulties with speech intelligibility, children who might have social communication impairments, or children with fluency disorders such as cluttering and stuttering as well. Speech language and communication needs as a category. So the children who are described within this term, they could either have temporary difficulties, for instance, children who might be late talkers and have initial language delays, and they are able to overcome these later on. But it might also include children who might have more persistent difficulties, such as children with language disorders. Children who again are described or come under that category of SLCN, they could have difficulties that are primary, so difficulties with communication that are not explained by any other conditions, or they could occur along other conditions or be secondary to other conditions. For instance, some children might have language difficulties due that are secondary to hearing loss or to autism or to other genetic syndromes such as Down syndrome. And the term as well, or children who have speech, language, and communication needs, the needs and the difficulties that they might have, they might change over time. So, for instance, children who might enter school with language difficulties later on, they might also exhibit difficulties with literacy, or they might start showing difficulties in other areas such as social emotional development or literacy or well-being. So it's very important to keep in mind that these difficulties change over time. So, within this broad category of speech, language, and communication needs, we have children who have persistent and lifelong difficulties with language. And these include children who have developmental language disorder. So, children or developmental language disorder is the term that we use to describe children who have difficulties in using or understanding language that are not associated with any other biomedical conditions. Usually, these difficulties are severe enough that they might impact the child's learning at school or their everyday social communication. And as we said earlier, these are likely to be persistent difficulties. So these are lifelong difficulties. They're unlikely to resolve spontaneously, and many of these children will require specialist support. Within that category of speech, language, and communication needs, we also have children who might have language difficulties that might be secondary to other conditions, which again, they will need specialist support, but the manifestation of their difficulties might be dependent on the associated conditions. So in the UK, the term speech, language, and communication needs is used very often in educational settings. And this is because the Special Educational Code of Practice categorizes children who have difficulties with communication under this category. And around 26% of students in the UK who are receiving special educational support in schools, they have a primary difficulty in communication. So their primary area of need is speech, language, and communication. And around 7% of children at school entry in the UK will have developmental language disorder. And this is going to be around 1 to 2 children, or around 2 children in every classroom of 30. So we can see here that speech, language, and communication needs, including developmental language disorder, are lifelong conditions. They are persistent. They might have a negative impact on the outcomes of these individuals. And that's why early identification and support is important. And what I'm focusing on is the support and the identification that can be done at or in school and at educational settings. So, what we did, we were asked by the Department of Education in the UK to look at the research evidence about the best available evidence or the most up-to-date evidence about what works in terms of supporting children with speech, language, and communication needs in mainstream schools. So that was the context where we focused on in this report. So the purpose of this report is that we wanted to understand um, how our children with speech, language, and communication needs are being identified, and what kind of tools are available for the identification that can be used by teachers or other professionals. We looked at what interventions appear to be effective and might have where there is evidence that they are effective and they can lead to improvements in the language skills of children with SLCN, including those with DLD. And we also looked at whether there is any evidence around the collaboration between schools, professionals, and families in helping delivering and achieving that identification and support. So, what we did is something called a rapid evidence review. So, what we did is that we looked at a number of systematic reviews or meta analyses. So, these are types of studies that already kind of summarize and synthesize a lot of studies that were done on a particular topic. And these are the type of studies that we wanted to use for our report. So we did not look for individual studies. We just looked at existing research that reviewed previous studies, and we evaluated their quality. And we had a set of criteria that we used to include these studies. So we looked at the reviews that were published around speech, language, and communication needs in the past 10 years. So between 2014 and 2024. We included reviews that focused on children from the age of 5 up to the age of 25. So we included those that included children and young people with speech, language, and communication needs. After we have done a process of screening and identifying which reviews were relevant to our report, we ended up with having around 14 reviews that had information about different identification approaches for SLCN and around 13 reviews that were focused on intervention approaches for speech, language, and communication needs. So I'm going to start by just giving you a little bit of an overview about some of the approaches for identification that we found. I'm mainly going to focus on approaches that are related to the identification of speech and language difficulties. But if you check the report, you might be able to see other approaches for identifying literacy difficulties and other behavioral and cognitive difficulties as well. So, in terms of the evidence that we found around the identification of speech, language, and communication needs in school settings, it's very important, first of all, to note that it's usually the teachers that might begin the identification process. So if a teacher has a concern about the child's language, then this is where the process of discussing the outcomes with the SINCO or the special education coordinator in school or with families would begin. So teachers have a really important role in being able to spot the red flags and to know that a child is struggling with language. Um, Usually, the mainstream teachers are able to identify that a child is struggling with learning at school, but they are unable to give a diagnosis. So they might be able to tell that a child is struggling, for instance, with reading, or they are struggling with understanding instruction in the classroom. A teacher might be able to tell that a child is struggling with, completing group work or completing homework, but they will not be able to provide a diagnosis. To get a diagnosis, the child will need to be referred to a speech and language therapist to receive a full assessment and diagnosis. And another thing that we need to note is that identifying or knowing that a child is struggling is not enough to determine whether a child is going to have and go on to have long-term language difficulties. So it usually having a an identification or concerns that a child has a problem does not mean that the child is going to continue having difficulties or that their difficulties are going to be very specific only to language. And that's why referral to assessment will be very important. Another key thing to consider when thinking about identifying SLCN and language difficulties is that we need to take into account the input from the families and the parents. A lot of the times, especially if a child, for instance, is speaking English as an additional language, we need to gain more information from the parents to understand exposure, to try and understand whether the difficulties that a child has are related to reduced exposure to English or whether it is related to DLD or SLCN. We also need the family's input in order to understand the developmental history of the child and whether there were any risk factors that might be really indicators that a child has an underlying problem. Another key thing that was evident in the research is that, again, speech, language, and communication needs, as I said earlier, they will change over time. So, for instance, a child difficulty might, or a child might have a speech, language, and communication need as the primary area that they need support in early school or in preschool. But then once they enter grade one and grade two, when they begin learning phonics and reading and writing, their difficulties might become more evident in literacy. So the areas are going to change over time, and that's why we need to continue monitoring. Another thing that was evident in the research, which is not new, and this is something that Bishop and the Catalyes have reported years ago, that the terminology that is used to describe SLCN really varies in research and practice. So in the UK, within the Department of Education and in schools, we use the term speech, language, and communication needs. But for instance, in clinical settings, we might use the term developmental language disorder or language disorder. So the terms are different across different contexts, and this is going to impact how professionals communicate with each other about children's needs. So these are just this is just a summary about some of the approaches that have been tested in the reviews that we've looked at. And these are the different approaches that have been shown to be useful or have shown promise in identifying children with speech, language, and communication needs. So some of the approaches that have been recommended are related to the use of language samples. So this includes recording a language sample from the child during a conversation or during play or during the classroom. And this is a really useful approach because it does not really require a lot of resources and it allows us to gain, or it allows teachers particularly to gain ideas about the vocabulary, the grammatical competency of the child. And research has shown that it has a strong evidence in, there was a strong evidence in the sensitivity of language samples to the difficulties that children might exhibit in language. The use of verb tense, so verb endings such as the past tense ed, the present tense s, all of these, and the correct use of verb tense appear to be a critical clinical marker of children with developmental language disorder, and it has been shown to be a moderate marker or a marker for DLD in preschool age children, but also in school age children. Research has actually shown that children with DLD, even at the age of 8 years, so towards the end of primary school, they might still show difficulties with using verb tense in spoken language and also in writing. Sentence repetition is a task that has also shown a promise in identifying DLD. So this is usually a task where we would read a sentence to the student and ask them to repeat it, and it assesses. It's a processing measure. So we look at how children process language, but it also taps into their memory. To be able to repeat a sentence correctly, you need to have good memory and you need to have good command and competency in linguistic knowledge. So these sentence repetition tasks have been shown to be as a potential marker for developmental language disorder. Researchers have shown that they can distinguish between children with and without DLD in preschool age and school age. However, there are inconsistencies in the literature. And so sometimes these tasks could have really excellent accuracy in identifying DLD, but others wouldn't. And these really depend on the age groups that we're working with and also the type of complexity and the type of test that we are using. A task that is often used for identification is non-word repetition. So this is a task where we ask children to repeat words with no meaning. For instance, if I say the word biklafu, or if I say the word to you, biklafu or Bilu, it will not mean anything to you. And in order to repeat that word, you need to rely on your ability to process the spoken word, store it in your memory, retrieve it, and say it again. So it's a measure of something that we call phonological processing, which is a really good indicator as well of children's literacy development. Researchers have also shown that non-word repetition tasks are also useful for identifying and screening children with developmental language disorder, but its evidence for diagnosis is limited. So, although all of these appear to have some evidence that shows that they could help in identifying children with DLD, some of them are very simple that they can be administered by school staff. However, the issue is that we cannot use only one test in order to determine if a child has DLD. It will be a combination of measures that will be needed. But these could be tests to identify children who might need further support. In terms of one of the things that came up when we were looking at the evidence is the identification of speech, language, and communication needs and DLD in multilingual children. There is a widespread misconception that multilingualism causes or leads to developmental language disorder or language difficulties, which is not true. Um, Although what the challenge is that the profiles of children who are multilingual are usually very diverse and they're very heterogeneous, and sometimes it's very difficult to tell whether a child is struggling with language, because if they are multilingual, it's very difficult to tell if they are struggling with language because they have an underlying condition such as DLD, or whether they just did not have enough exposure to English or the target language that we're interested in. But what we've seen from the research is that for children who are multilingual, when speech and language therapists or teachers are concerned, it's very important to explore whether the child has language difficulties in both of the languages that the child is speaking, because it's very likely that if a child has DLD, they will have a difficulty in, or they will show difficulties in both of their languages. And in order to help with the identification of these children, it's very important to um, be careful about the way that we conduct assessments. So one of the tools I mentioned earlier, the non-word repetition task, because it relies on the processing rather than specific knowledge of language, this appears to be a good marker or a good tool to use for children who are multilingual, because even if they don't speak English, we're not really assessing their English, we're processing their um, we're basically looking at their processing skills. And there are other approaches such as dynamic assessments by looking at the children's potential to learn. These have been shown as two approaches that could be useful for identifying children who are multilingual. Yes, Michelle.
There was a question in the chat which I just wanted
Yes.
to bring up. If I can find the chat again. There we go. Um, Somebody has said, I'm nervous about using verb tense use for identification children who are multilingual. What are your thoughts?
Um, I will talk about it later, but essentially, um, there is nothing wrong with actually like using the verb tense as a way to look into children's knowledge of grammar and whether, they have verb difficulties. But it's also very important. So, for instance, if you look at the children's use of verb tense in English and the child, for instance, is a multilingual, you might want to consider other areas, and you might want to consider their verb use in their language as well, because if they have a problem with grammar, then it's very likely to manifest in all of the languages they're speaking. In terms of grammar, in terms of verb tense, on its own, as I said, it's not enough to determine that a child is has DLD just because they're struggling with past tense ED. We need to look more widely at their grammatical skills, and we will need to look at other areas of language, like their vocabulary, for instance, and storytelling skills. So it's one thing that gives us an idea about the child. It gives us some information, but it's not the only information we have to follow. So yeah, I hope that answered your question. Um, and just here, one last thing to say is that it's very important when working with multilingual children, especially both like teachers or speech and language therapists, to be very careful about the type of tools that we use to assess these children. Many of the children, especially multilinguals, might have different cultural contexts. Some of the items that are used in the standardized assessments that we use for language or even reading might not be familiar to children who are multilingual, which might put them at a disadvantage. Sometimes these children might know words. They might know a word for an item in their home language, but they do not necessarily know it in English. So it's very important to make sure that we collect data from all of the languages that the child is speaking. So, for teachers, particularly, we might want to talk with the parents and try to understand whether the difficulties we're observing in the classroom or with their English are also evident in their other language. Okay. Now I'm going to talk about support and different approaches for support. So in the UK, when we talk about support for children in general, we have three levels of support. First of all, we have something called quality first teaching, which is about the idea of delivering high quality teaching for all children. But this is also going to be useful for children who have developmental language disorder or SLCN. Um, for children who do not benefit from the regular first quality teaching, which is the regular teaching essentially, we might want to provide them with additional support. And this could be additional support that can be provided by the teachers, by the school, for instance, the school staff like the Cinco or the teaching assistants, where the child might have, extra one-to-one support or small group support. We also have specialist support, and here we're talking about the support that can be provided specifically by speech and language therapists. The approaches that I'm going to mention, these are the interventions that we found in the reviews that we've included in the report. There might be other interventions out there that we could not capture just because maybe they were not reviewed in a systematic review, for instance. But when I mention these approaches, I'm going to be also talking about their effectiveness and their effectiveness based on who actually delivers these interventions. So, in terms of the quality first support or being able to essentially deliver high quality teaching that is accessible to all children in the classroom, there are a few things that teachers can do to make sure that they have a language supportive classroom environment. It includes providing explicit instructions to the students and giving explicit cues about everything that the students are asked to do in the classroom. Scaffolding, for instance, if we are teaching children to use, going back to the example of grammatical rules or like past tense, then we might want to provide them with examples of these. We might want to think about if we have a child in the classroom and they're struggling with using grammar, we just need to make sure that every time that the child speaks, and if they make an error, then we would repeat what the child said or rephrase it, but in a more grammatical way. So, helping the child, building on the child's level and helping them move to the next level of using these more accurately. Thinking about how to divide the tasks that the children need to work on into smaller and manageable steps. For instance, when we give instructions to children, instead of saying, open your books, go to page 3 and look at the picture, this is a very long, complex sentence, and children with language difficulties, including DLD, might really struggle with understanding that. So you might want to think about how to make it smaller, or how to get children to maybe use visuals where we show children that they have to do three things. We can say books, page three, picture, so that we're trying to just highlight to them the key information they need. And another key part of quality first teaching is providing children with a lot of opportunities to practice language, to use language through group activities or peer activities. Thinking about when we have a child as well in the classroom who might be struggling with language, thinking about how we can pair them with another child who is more capable, that could help the child with DOD to, see more examples of good use of language, so that they can also um, get more opportunities of exposure. Taking these things into account is very important because children with DLD have difficulties with processing. So, as I said, they might really struggle with understanding instruction, and they might forget what they were told to do. So, making sure that we provide shorter instructions, give a lot of visual support, thinking about opportunities that we can give them, structured opportunities as well. To express themselves is very important. And another thing that I did not mention here is also the use of visuals, because again, children with DLD might really struggle with understanding spoken language. So if we aid that with cues or with pictures, that might really help them with understanding. Another thing that we need to take into account is the classroom environment. So it's very important that teachers manage the background noise at all times. For instance, if the corridor is loud, the teachers should close the door. If the window is open and there is traffic, then they might want to consider closing the window. And that's because research has shown that children who are in classrooms that are noisy, they don't do as well on literacy and language tests compared to children who are in quieter environments. And for children with DLD, because it might be distracting as well for them. Another thing that could be useful is to make sure that we have pictures and learning areas that are labeled in the classroom. And this is really going to help children in acquiring vocabulary as well, not just DLD, but all children. Because when we, for instance, say we're going to the library, and then they see the picture of a library, and then they see the word library, like the letters of the word library, it will really help them in having these information to consolidate their learning and understanding of these words. Another thing that's important is reducing classroom clutter. So, although the use of these labels are important, we need to be really careful about where do we locate these decorations and these labels, because children with DLD might be really distracted, and research has shown that some of them might have visual processing difficulties. It might be too much for them to, understand instruction and at the same time looking at all of the visuals around them. So it's something to also consider. Another thing is considering where do we see children who have language difficulties in the classroom, making sure they are sat somewhere near the teacher so that the teacher would have opportunities to check on their understanding, and that the child will be less likely to be distracted. And again, we can consider using visuals. Beside the instruction, we could also think about when children, for instance, are in primary school, we could have, or we could give them a visual table so that they understand what's happening during the day. When they go to secondary school, the timetable becomes even much more complex. So thinking about how to provide them with visual resources that could help them with their learning. This is just a tool that is often used by researchers, and it is a tool that can be used to profile the language learning environments, the language learning interactions, and even the type of language that teachers use in the classroom. So it's a really good tool that teachers and schools can use to identify what can be improved in their language, in their classroom environments. In terms of targeted support, so here I'm going to talk about the support that we can provide for children who cannot really benefit from the high quality or the regular teaching approaches. So these, as I said earlier, are often delivered in small groups or one-to-one or one-to-one settings. Some of them could be delivered by speech and language therapists or TAs or teachers. These will vary. In terms of the different interventions we found some interventions that focused on vocabulary, and these interventions or these kind of supports would focus on explicitly teaching children different vocabulary with their definitions and giving them examples. For instance, before the class, or if the child is learning something about ecosystems in that week, then a group support might be about introducing that word and giving them some activities to expose them more to this word. It also includes things related to elaboration strategies. So, for instance, this is related to how we can link the new words that the child knows to other words that they've known before, making sure that we provide children with opportunities to be exposed to the words in different settings. For instance, in an activity where they sing the word or write the word or draw the word, thinking about how do we match the word with existing words, because this is going to really aid understanding. So if you see here on the right, this is basically a representation of how we would store words in our memory. So we would want to think about how can we link this new word with other words that the child knows. So that would really help with learning and understanding. In terms of the effectiveness of these approaches, research essentially has shown that interventions that introduced or that have tried to teach vocabulary, where they introduce the spoken and the written forms of words, appear to have a positive effects on remembering and learning these words. And they found that programs that specifically focus on introducing not just the writing and the spoken form of the word, but when they teach the word, they try to get the child to think about the phonological structure of the word. For instance, thinking about words that rhyme with it, thinking about the first sound they hear in the word, so phonology, but also thinking about other words that might be related to it. And the interventions that appear to be effective are the ones that would be delivered a few times a week. And they also found that teaching or some of the interventions that used morphology or taught children about how to use morphology to understand and break words appear to have a positive impact as well. In terms of narratives, so with narrative support, essentially, we are trying to get children to produce clearer and more organized stories, to teach them how to structure a story. For instance, teaching them that a story has different characters, that there is a beginning, a middle, and an end, and something that we're trying to resolve. It includes using things such as visuals, as you see here on the right. So we could show a child a picture and get them to describe what's happening. If the child is a little bit older and we're asking them to write a story, then we can give them different types of these cues to follow to form the story. And these can be delivered one-to-one or in small groups. In terms of their effectiveness, research on narrative interventions have shown that they lead to moderate improvements, particularly in the structure and coherence of stories. So, if you do narrative interventions, these appear to also have positive impacts on children's narratives. They do have much smaller but meaningful impact on children's vocabulary and grammar. And they appear to be mostly effective when they are delivered one-to-one rather than in group settings. However, what the evidence have shown is that these narrative interventions, like children might show improvements, but these might not necessarily transfer to other stories, for instance. So how much we generalize that benefit to other stories is not there yet. In terms of grammar, um, supporting grammar. Yes, Michelle, sorry.
I just wanted to say, can we try to wrap up in the next 4 minutes to allow at least
Yes, yeah,
15
yeah,
minutes of talk? Okay.
yes. In terms of grammar, so here it involves as we said earlier, for instance, the teacher modeling the correct sentences to the child or trying to rephrase the sentences that are produced by the child. So if they say something wrong, we try to recorrect it, explaining the grammatical rules in an explicit way to the children. And these can be, again, delivered either one-to-one or in small groups. In terms of their effectiveness, interventions have shown that for younger children with language difficulties, modeling or providing them with models of the target grammatical structures that they need to use and doing recasting, especially in one-to-one sessions, has shown to be effective for improving their grammar. For older children, it appears that explaining the grammatical rules to them appears to be more effective for identifying and supporting their grammatical difficulties. And the strongest effects for grammar, so the most effective grammatical interventions are those that are led by speech and language therapists, although TAs or trained TAs can actually support with these, but they have to be led by a trained therapist. Um, just lastly, it's very important that in order to achieve the identification and the provide the support, it's very important that there is collaboration between the schools and the teachers, that the parents have very important information about early risk factors. And whenever we have concerns about the child, we will need to think about how do the teachers and the speech therapists communicate with the teachers and other professionals as well. So the collaboration will be very important to achieve the identification and support that I've talked about earlier. And lastly, it's very important that there is some shared understanding of the strengths and the weaknesses of the child, that there is some collaboration so that we can generalize what the child is doing in the classroom or in speech and language therapy, and that's also being applied at home. That there is clear communication about progress and also specifically communication about whether the needs of the child are changing, because I said earlier the needs might change over time. Um, this was just a slide about the strengths and the limitations of the evidence that we've discussed, but I'm just going to leave that. But you can feel free to ask me about it later. Thank you.
Thank you very much. I'm just going to stop the recording now and then we can take any questions. Recording is